يفرق كثير لما يكون اللي معك عاش نفس تجربتك، عاش كل اللي تحس فيه الآن، خاض نفس المعارك مع المرض والمجتمع. كنت أحس أني ميت لا محالة، ولكن بعد أن من الله علي بالتعافي قررت أني أكون معك، أدعمك وأتفهم ردة فعلك، وأكون دليلك لأفضل طريق للانتصار في معركتك، مع مجموعة من استشاريي الأورام والأخصائيين في مختلف التخصصات، سواء الاجتماعية والنفسية والعلاج الكيماوي والإشعاعي. مع مؤسسة متعافي السرطان الوقفية نشرح لك آلية التعامل مع العلاج، ونثقف من هم حولك والمجتمع عن مرض السرطان. مؤسسة متعافي السرطان الوقفية، نتغلب سوية على معركتك.
Ms. Anita, you can start.
بداية أنا حاب أرحب فيكم في المؤتمر الأول الافتراضي. Welcome to the first of Motaafi international webinar. May I represent Ms. Anita Moore. She will be our monitor for this discussion. She's the first consul of the Saudi Center of Patient Safety. She has been working for 35 years in strategic planning and public health, and also for patient engagement programs in Canada. Welcome, Ms. Anita. The floor is yours. Ms. Anita?
Ms. Anita, you're unmuted. Ms. Anita? Ms. Anita, are you there?
Ms. Anita?
Yes.
You're actually on. Waiting for you.
Oh, okay. I thought. Okay. Sorry. Good evening, everybody. Welcome. My name is Anita Moore, and I will be your moderator. Can you hear me okay?
Yes.
Yes. Okay, I see some nods. Great. Welcome to the first Motaafi International Patient Engagement webinar. And we will start this session today with some welcome remarks from the Chief Executive Officer of Motaafi, Mr. Fahad bin Mashallah. Is he on?
Yes. Yes, here.
Here we go.
First of all, Motaafi has started 11 years old.
Fahad, you have muted your mic, I guess.
Okay. First of all, Motaafi has started from 11 years old as a support group from people who has cancer before and got treated. It was discovered by them, the people who had that journey without any support and no justification for their own experience. After they got survived out of this cancer issue, they stay together and also try to figure out what's common between everyone to help and improve the quality of services and also the journey for the incoming patient next out of them. In 2017, it has transformed to Motaafi Foundation as an endowment to stay more and to be more sustainable, to help the patient and support them during their own journey. In 2018, Motaafi has got a reward out of the National Patient Safety Award at the first conference of in the non-government organizations in Saudi Arabia, developing the way of treatment by developing a design thinking of the journey. We have started by making 3 phases of the whole journey, starting with diagnosis, which is the first step of making the right choice for the whole journey. If we diagnose very well, we can do the treatment plan as well until we get to the recovery and we get the feedback from the patient to develop the healthcare system and to support decision maker here in Saudi Arabia to make the other policies that needed and necessary need to do an action to have to take. Motaafi today has started this webinar internationally. We used to take other experience here locally in Saudi Arabia, and we know how treatment goes well. And also because we are impassioned, and also we want to improve our healthcare system, we would like to have an international experiences so we can add value to the whole world, also to the healthcare systems around the world that aligned with the Sustainable Development Goals, and also increasing the value of human being in Saudi Arabia and also around the world. Here in Kingdom Saudi Arabia, we have this vision of 2030. It's an impassion to make the citizen more responsible and improve the good quality of life and with all dimensions. All the best to us in this international webinar, and I hope we can get more and more outcomes in this remarkable choices that we have taken.
Thank you very much. That was an excellent opening, and your journey has been one of great success and achievement. I would like to go ahead now and introduce Dr. Natalie Yates Bolton. She's a senior lecturer in nursing at the University of Salford and associate consultant for the Hamad Care International. Her work includes teaching pre-registration nurses and postgraduate nurses, health and social care professionals. She supervises professional doctorate to research studies, also is an international lead for staff and student mobility for the School of Health and Society, University of Salford. In her consulting role, she supports the project work of Hamad Care International, a dementia care organization. Her clinical background is in surgical nursing, neuromedicine, and nursing home care of older people. She has involved in and worked in UK and Australia, has been awarded 2 Florence Nightingale scholarships for travel and leadership, which included nursing scholarship placements in the USA, Australia, and leadership program at Stanford University. During the COVID-19 pandemic, she has been a facilitator at the Nightingale Leadership Support Service, an online support service provided by the Florence Nightingale Foundation for nurses in England. So Natalie has a PhD in flourishing, meaning, and purpose in care home life, and a master's in nursing from the University of Salford. Welcome, Natalie. And today her talk will be on, and her presentation will be on the 5 building blocks for cancer survivors, rebuilding lives after diagnosis and treatment. I will now open it up for you, Natalie. Thank you very much.
Thanks, Anita, and thank you for the invitation to the Motaafi organisation, who I met when I was fortunate enough to come to Riyadh in December 2019 to the Saudi Patient Safety Centre, which was so inspiring that I'll be teaching my undergraduate nurses next week all about patient safety from the Saudi perspective. I was so inspired. So that's how I come to be with you this evening, when really I'm sat in a very cold Manchester in the north of England. So if I keep rubbing my hands together, it's because I'm trying to keep warm. So the 5 blocks. So I have my 5 wooden blocks here, and I would like to talk about how these 5 blocks are useful to people who have cancer or who have survived cancer. I'd like to talk about how they're useful to healthcare professionals who might be working with people who have cancer and have survived cancer. And I'll then just briefly talk about what these 5 blocks have looked like in my life in the last 30 years. So not very high tech, but here are my wooden blocks. So the first block is about the physical environment. So here we go, physical environment. So if you're a person who has cancer or you've survived cancer, the physical environment, I really recommend that you think about how does that impact on your well-being? Which places and spaces are therapeutic to you in your life? And when you've worked those out, seek those places. And if there are places and spaces that dampen down how you're feeling about your life, don't go to those places. Seek out physical environments that support your well-being. The next wooden block in my high-tech prompts here is your identity. Cancer can really impact on your identity, but you can take control of that, and you can decide before you had cancer what were the important aspects of your identity, and decide that you are going to cling hold of those and you are not going to let cancer take those from you. So plan with your oncologist, plan with your family and friends. How can you be supported in your life to maintain your identity? Your identity is what you project to the world and to other people. And that's the only thing that other people can respond to. So I don't recommend being fake. I recommend being authentic in your identity, but give people the aspects of your identity that you want them to respond to. My next wooden block is the dynamics of relationship. As with your identity, cancer can really impact negatively on your relationships with family and friends. And as with your identity, if you have cancer, you need to decide which are your important relationships and how are you going to protect those as you go through your cancer treatment and come out as a cancer survivor, or maybe have a prolonged cancer journey. Really be mindful of your relationships and protect those relationships. Relationships are dynamic, so that's why I don't just have an R there. It's the dynamics of relationships. How can you keep those relationships as a two-way exchange? If it's a one-way of people caring for you, your relationships won't be sustainable long-term. And as your cancer journey progresses, you'll find that family and friends will fall away. Whereas if you make sure it's a dynamic relationship and you continue to care and support your friends, your family, your care partners in the hospitals and the oncology teams, you'll find that those relationships are sustainable long-term. And I've been doing this for 30 years, so I hope that I am practicing what I'm preaching here. The focus of activity. When you have cancer, you have surgery, you have treatment, the side effects may mean that the activities that are really important to you may need to be modified, but you decide which activities are important. How are you going to modify them? Do some need to be put to one side to later in your patient experience and then be picked up later? And communicate that with your healthcare professional in your oncology team so they can work with you. They're not mind readers. And if you don't let them know what are the important aspects of your identity, your relationships, and which activities are important to you, they can't work out how best to support you. As somebody with cancer or who has survived cancer, you need to be very proactive and engaged with your healthcare team. And then last of all, C for care, the component of care. And that really links back to the dynamics of relationships. You need to be providing care to others as much as you're receiving care. And it might just be in really small ways if you're quite sick with the side effects, but always keep in your mind that as much as we receive care from family, friends, and healthcare professionals, we also need to be mindful of how we give care back to family, friends, and healthcare professionals. So I'm going to go through this process another 2 times. So that's how I think people with cancer generally could think about these 5 building blocks as they go through cancer, as they survive cancer, or have a prolonged journey through cancer. So I'm just going to bring my blocks down. When I looked in my diary yesterday, just to check the arrangements for this webinar and check the time difference between the 2 kingdoms, the Kingdom of Saudi Arabia and the United Kingdom, I noticed that the webinar today coincided with a reminder in my diary to take palbociclib. So that's my targeted therapy. It's one of the newest generation of cancer treatments. It's a CDK4/6 kinase inhibitor, if you really want to know. I've been taking it for 3 years. I think it's a wonder drug, and I'm just so grateful that I have the opportunity to take that drug. And it's for people with advanced cancer. So I think my story, I'm either a wonderful success story because I've had cancer 5 times, recovered, and then gone on till the next time, or I'm a disaster story. So whichever way you choose to look at it, that's your prerogative. I think I'm a success story, but I'm not a success story because of me as an individual. I think my story is a story of success because of the way my healthcare professionals in my oncology team and my family and friends have supported me. So we'll just look at what these blocks mean for my healthcare professionals. So the hospital where I'm treated, the physical environment, it reflects what's really important to me in my life. So in my life, I like to be in green space. I like to be running in the woods. I like to be running across the moors of the north of England. I like to be in the forest. I really need green space. And in the hospital where I'm treated and where my oncology unit is, there are green spaces. There are some gardens inside the hospital. There are wide corridors with lovely big glass windows. There are big open spaces, really used creatively. So if you're a healthcare professional, how do you know that the physical environment of your hospital and your clinics has a therapeutic effect on your patients? Do you ask them, how does this physical environment make you feel? And how do you take steps to constantly refresh and develop the therapeutic environment, the physical environment where patients meet you and have their treatment? So for me, there are a couple of aspects of my identity that are really important. For me, being a mum to my 2 daughters is really important. Being a senior lecturer in nursing is really important. And being a runner, being a long distance runner is really important. Those are 3 parts of my identity. And I'm so grateful that my oncology team have taken time to find that out about me. So if you're a healthcare professional, do you take time every time you meet your patient to find out something about their identity, to know what's important and how that can be supported through their cancer journey? Dynamics of relationships. So for me, being a mum is important, working with my students is important, and being with my running friends is important. And again, my oncology team know that and make sure that my treatment means that I can have those relationships and live those relationships well. My oncology team have also built up a really strong relationship with me. We've got a very honest and open relationship, and I can ask questions, I can suggest changes in my treatment. Because my treatment is quite new, after 2 years, I was feeling that the full dose of 125 milligrams was quite strong. My cancer on scans, there's nothing to see because the way it keeps coming back, fortunately, is in my skin, so it can keep being cut out. So I'm just cut and heal and cut and heal, cut and heal. So I'm quite fortunate that in my last scan, there was no sign of cancer. So in one way, I've got advanced cancer, in the other way, there's nothing to see. So I said to my team, I'd like to go down to 100 milligrams. And because there's not that much evidence on the correct dose, because it's a new drug, the team have decided, let's try it. Let's go for 100 milligrams. And that means I just have that bit more energy. But I had to think about focus of activity. If I was going to reduce my drug and take the chance of reducing it by 25%, I had to do the same with my work life. So much as I love being a senior lecturer in nursing, if I'm going to reduce my drugs by 20%, I've got to reduce my workload by 20%. For me, that seemed like a balanced equation. So I reduced my workload at the university to 4 days a week. I then did manage to sneak in the consultancy for the Australian company on the 5th day. So I don't know if I've quite stuck to my part of the agreement, but I've made an effort. So my oncology team have definitely worked in partnership, and I feel I'm a very proactive, engaged and empowered patient. But it's no good if I feel that and my team don't work with me in that way. So I am so fortunate to have a team who do make sure I'm empowered, equipped to make decisions. And in our relationship, it is a partnership. So the last block, component of care. I think it's really important that I care back for my oncology team. I think it's important that I watch the nurses who are, when I've been at IV chemo, if I watch them, does it look like they've been on a 10-hour shift and they're exhausted? If they do look like that, I surely make time to ask them how they're feeling and offer some compassion back to them. If I sit with my oncologist and I see the way he sits in his chair, that he's had a really tough day, after he's asked me how I am and we've planned my care, I'll always make sure that I ask him how he is, and that way our relationship builds over the years. So as I receive care back and compassion, I have to make sure I give that back to everybody. So those are the 3 run-throughs, although I've merged the last 2 together because I'm mindful of time. So if you're a patient who has cancer or a survivor of cancer, I hope these 5 blocks have been useful, and you can use these 5 blocks maybe just to evaluate your life and where you're going. If you're a healthcare provider, if you're a nurse, doctor, occupational therapist, radiologist, radiotherapist, pharmacist, I hope these blocks might have given you some ideas to think about as you go forward, how you can make sure that you provide care in a way that empowers and equips your patients to wholeheartedly engage in their lives and wholeheartedly engage in their care partnership with you. So thank you very much.
Thank you, Natalie, for that very great presentation. I think the 5 building blocks were very empowering tips that all of us can use. And also, I really enjoyed listening on how the compassion is not just for the patient, but also for the staff. And I think it's really important that we acknowledge the staff that also work with us. Thank you very much. And we will have questions and discussions at the end of the session. So if you can keep hold of those, I'm sure everybody has some really good comments and suggestions that would be really appreciated. So now we'll move on to Robin McKee. Robin, can you? Yeah, great. Thank you, Robin. Robin is from Canada, Nova Scotia, and that's where I'm from. So welcome, Robin. I'm sure it's getting a little colder there as well. Yes. And so Robin is a registered clinical psychologist who has worked in health and education for over 30 years. Her award-winning book, The Cancer Olympics, describes her fight for medical justice and fair chemotherapy policy after serious medical negligence. She has been decorated by the Governor General of Canada for her work in patient advocacy and patient safety. Also, she has been awarded the Canadian Cancer Society's highest honor, the National Medal of Courage. Proceeds of her book go to cancer support programs. She can be found on the web at www.thecancerolympics.com, Facebook, and on Twitter. Robin is currently in treatment for reoccurrence of her stage. Thank you very much for joining us, Robin, and I know you're going to share some of your experience with us here tonight. Go ahead.
Thank you. And let me just say what an honor it is to be joining you today and to be part of an international audience. I'm often speaking Canadian audiences, but it's a real thrill to speak to other people from other nations. So as you heard, I'm talking to you today from beautiful Nova Scotia in Canada. And I am a member of a group called Patients for Patient Safety Canada. My colleague, Iona Popescu, will be talking about our organization in more depth and talk about our structure and our mission and so forth. But what I'd like to do today is sort of talk about my story of how I got into the patient safety world and the kinds of things that made that happen. So I'll start off by saying that Patients for Patient Safety Canada is a vetted group of patients who have been harmed by medical care that was unfortunately substandard, and our members have lost children, they've lost their abilities, their limbs. In my case, I will lose my life to this disease, and I did not have to had I been treated more appropriately. So I'll just by way of background, there's a lot. I've had cancer for 10 years now, so I have a lengthy story, but I'll try to, we'll keep it within the time. So I was diagnosed with colorectal cancer in 2010. Unfortunately, the diagnostic care I got to that diagnosis was really, really terrible. And I need to tell you that it's not just my opinion that the care was terrible. The doctors, 4 doctors on my diagnostic pathway, were disciplined by the medical board here in Nova Scotia for egregious cancer negligence, as I presented to them with daily bowel bleeding, an immediate family history of colorectal cancer, and a positive cancer screening test. However, all 4 came to the conclusion that people under 50 can't get cancer, can't get colorectal cancer. I was 46 at the time I presented. I wasn't 26, but nevertheless, they said no scope for you. So in best practice for colorectal cancer, as many of you know, is that from symptom onset to workup, diagnostic workup should be only 60 days. I did not wait 60 days. I waited 661 days, so nearly 2 years, to access diagnostic endoscopy. By then, the disease was stage 4. Had I been intervened with earlier, then I perhaps could have made it, but that's not going to happen now. So unfortunately, that was what occurred. Another sad aspect of this, which brought me into sort of patient advocacy world, was that the best practice chemotherapy for my kind of cancer was not available in Nova Scotia in 2010. So my community and I lobbied the provincial government to extend the formulary to add the drug FOLFOX to the treatments available to people like me. We were successful after months, 6 months of lobbying in getting that to happen. Unfortunately, too late for me to receive it. So I also was significantly undertreated for the cancer that I presented with initially. So I went into remission for about 7 years. That was lovely. But unfortunately, the cancer occurred in 2017. And then sadly and disturbingly, I was the victim of terrible medical negligence again. And that was a distracted radiologist missed a 2-centimeter tumor on a CT scan, wrote a report saying no cancer, nothing to see here, folks. 6 months went by, my cancer markers in my blood went up and up. I was clearly having lots of symptoms. It took me 6 months of lobbying to get another scan, which revealed the malignancy. And by then it had grown from 2 centimeters to 10 centimeters. And it had made its way through various organs and unfortunately very deep into the pelvic sidewall, so deep that it's inoperable in that location, meaning that I have no further treatment options besides chemotherapy for life, which, as you see, is the path I'm on now. So I was harmed horrifically twice. The surgeon I saw in 2017 said, you know, I maybe could have even cured you had I been able to get you when it was 2 centimeters. It was hopeless by the time it was 10. So I lost my chance 2 times with the first 4 doctors and the this bad radiologist. So that experience of advocacy, successful advocacy and medical wrongdoing led to my passion and commitment towards patient safety, and to our motto of our work is every patient safe. And so while my lack of safety occurred both in hospital and out of hospital in terms of where the errors occurred and the wrongdoings that happened, of which I won't get into the details because they're too extensive. But the long and the short of it is that even the doctors' lawyers, after 7 years of litigation, even the doctors' lawyers conceded that the care I received was indefensible because they could find no expert anywhere in the world able to defend the care that I received diagnostically because it was that bad. So that tells you something. So I did write a book about that experience, the advocacy experience, the medical justice, pursuit of justice through the Medical Review Board. And that was called The Cancer Olympics, as you've heard. And that described that cancer experience, the second and now third cancer experience I'm on now. I write a blog about that, and that's where that's to be found. But anyway, what I wanted to talk a little bit about was what someone like me, who's now really committed to making sure that other people don't have to die either because of inadequate care and conventional kinds of errors like medication errors or hospital falls and hospital acquired infections, those kinds of things. Joining Patients for Patient Safety Canada, we are given opportunities to speak in settings like this one, but also I've spoken at health leadership conferences and a variety of venues to represent the harmed patient perspective. Often providers are afraid of harmed patients because they think we're like nut bars with an axe to grind and can't possibly meaningfully participate in healthcare reform. But what's missing in that is that we who are harmed are committed in a way that perhaps others of the general public may not. So we're interested in improving cancer care at the point of care, and we're also interested in making systemic improvements to the broader system that result in better patient safety tracking and resolution. So in my own case, something I did separately from Patients for Patient Safety Canada is I joined a series of working groups in my province aimed at improving standards of cancer care, and in particularly diagnostic care. And so was involved in many, maybe over 60 meetings trying to refine and improve how cancer care is delivered in my province of Nova Scotia. And so the other thing that we have done, or I've done, is, for example, through Patients for Patient Safety Canada, one of our most recent initiatives was a roundtable in which members of each province, escorted along with Patients for Patient Safety leadership, met with the health ministers of our respective provinces. And in that our ask was to talk about error and apology practice. So when medical harms and indefensible wrongdoings have happened, what can be done to approach those errors in a way that is results in healthcare reform and improvement? So moving beyond kind of the deny and defend culture of the law and combat in malpractice litigation and all of that, we're trying to steer resolution. Not to say that those things aren't important; they are important and have their place. But for many patients, harmed patients, what we're looking for is some sort of reparations in some sense, and they don't necessarily have to be financial. They can be in the form of an apology and a form of the system-wide commitment to correcting the error that led to your loved one's death or your dismemberment or any of the things that happened to you as a harmed person. So in medical care. So in our ask, we asked things like, we would like disclosures, if there's wrongdoing to happen, that the disclosures happen promptly, that the harmed person is actually spoken to and talked to about the harm for their unique perspective. In the same way you wouldn't investigate an accident without speaking to the actual witnesses to the accident. What did the patient witness and experience during their harm experience, and what has been the impact on them in terms of their health and their life, etc. And if there can be an apology, that would be that goes a long way, and also a declaration from the institution to investigate the matter and come to decisions that will improve care so that that kind of error doesn't happen again. So that is the thrust of our work. And we give, for example, in the fall before COVID, we made this presentation to the Minister of Health for my province, and myself and someone who'd lost a child spoke. And we were able to have a dialogue with the head of the health authority around such things as when patient harm instances are investigated, perhaps it would be a wise idea to have patient representation, not the harmed person, but a patient representative on that investigatory committee, because often the providers are only looking through the lens of their own reputations, and they're not really kind of thinking through the what is likely to be going through a patient's mind. And so when I say something like, so for example, with respect to reparations in my own instance, because of the terrible radiology that I'd experienced, one of the things that I had asked of my province, and they said they would do it from henceforth, is from now on, all my scans will be read by 2 radiologists to ensure that no one does it superficially again. And so that makes me feel a lot safer, makes me better able to engage in the cancer care that I have now, knowing that I can trust the scan results and they're not being done by someone who's blown it off for whatever reason, destruction or whatever. So so there's all sort of kinds of examples of the initiatives that we at Patients for Patient Safety Canada do, but we're involved in, we have our fingers in many healthcare pies, medication safety, fall safety, long-term care safety, issues like that. And in the era of COVID, we're concerned around caregiver presence, because of course, in the pandemic, caregivers were not allowed to be present for people in hospital. And that of course led to all kinds of safety issues, because if your loved ones can't speak for how your afternoon was, the staff don't know in the hospital, and mistakes get made. So these are the kinds of things that we're working on presently. So what I'll do, I'll leave it there. I know there's conscious of the time, but my colleague Iona will share with you how our organization works, and I think she's next after me.
Thank you very much, Robin. And that was a very interesting presentation. The strategies that you've used through the years for patient empowerment, engagement, to improve patient safety are amazing. So it will be good during the discussion to get a little deeper into those. Now I'd like to welcome Iona. Is she on? Iona, are you there? Oh, yes, you are. Okay, great. I didn't see you till now. Welcome, Iona. Iona is from the Canadian Patient Safety Institute. And I'm just going to speak a little bit about her. She's a senior program manager, and she's from Alberta, Canada. the other side of Nova Scotia, on the other end of the country. So your primary focus is on making care safer through patient engagement. Iona, after a decade of frontline nursing and an MBA from the University of Alberta. Oops, are we here? Okay, you're putting a slide presentation on, all right. And another decade of work in patient safety and patient engagement at the Canadian and global levels. Iona knows what it takes to successfully engage patients, providers, and leaders to improve safety. And I'd like to just say that Iona has been involved in engaging patients in patient safety, developing a Canadian guide, patient safety and incident management toolkit, the Canadian Incident Analysis Framework, and Safe Surgery Saves Lives program. Iona also brings her business and evaluation expertise in supporting the Canadian patient safety, corporate business processes, and performance management. So now I'd like to welcome Iona with her presentation on the experience for patients for Patient Safety Canada. Thank you. Iona, you
Yes.
go
Hello,
ahead.
everyone.
Yeah.
Can you hear me? Is the audio on? Yeah.
Yes, it is. Yeah, we can hear you.
Oh, assalamu alaikum. Thank you for having me here today. I'm very honored to share our story and our experience. And it's wonderful to see some of the old friends we made over time as we've been through this journey of patient engagement, patient safety, and as a collaborating center with the World Health Organization. In our over 15 years of engaging patients in Canada, and through our connections with patient partners and people from around the world, we learned very quickly that patient safety knows no geographic boundaries. There are no countries in patient safety. The medication incident or radiology incident that happens in one country can and will happen in another country. So we have to continue to learn together if we are to truly improve patient safety in our countries and around the world. So I'm honored to be here to learn with you and share with you. To begin our discussion today, I would like us to take a moment to just get centered on why are we doing this work? Why do we care about engaging patients, families, and communities in improving safety and quality? I believe it is because we have a special power. We can see behind the numbers. We all know the numbers. I have a few on the screens to talk about patient safety in Canada. But our superpower is that we have met the people and we have heard the stories. So we feel that is our duty and our imperative to do something, in other words, to engage in improving the lives of everyone. Because if we don't do it, who will? So I believe we all share that imperative. And we know that the voice and the presence of the people with the lived experiences is key to improvement. So I will share with you today a little bit about our story of how a group of passionate people like Robin built together a culture, structures, and approaches for engaging with healthcare providers and the healthcare system for improvement. The starting point of our journey was the firm belief that in that imperative that I just talked about. We can't accept the status quo and we have to make care safer. This imperative was expressed in the 2003 CPSI, the Canadian Patient Safety Institute first vision statement, which set the bar high by articulating how patients, providers, governments, and others should work together for a better healthcare system. It was also expressed in 2004 when WHO, the World Health Organization, launched the Patients for Patient Safety Global Program. People with lived experiences from around the world came together to write and are still supporting the pledge for partnership in the London Declaration. And that is to make healthcare as safe as possible, as soon as possible. That imperative was brought to life by the Canadian Patient Safety Institute, who not only invested in creating a patient community, which became Patients for Patient Safety Canada in 2006, but also engaged with patients in all of our improvement efforts. The support from the CPSI board and leadership was strong, visible, and very clear throughout our journey. Over the years, through our partnership with patients, through mistakes. Oh, sorry, I accidentally jumped to the next slide. We created structures and a culture that is supporting us to create leaders around the world. We are humbled that the WHO recognized our impact and asked if there would be possible to share how CPSI and Patients for Patient Safety Canada work together to improve safety around the world. And this is part of what we're doing today. I will not discuss the structures and the processes that we have set in place, but I would be more than happy to have a separate conversation with you around those structures later. In a sense, that is the easy part of actually impacting change. What is the hard part is actually focusing on a culture and on the people. So let's begin to discuss that a little bit. My diagram on the slide before was a little bit misleading because it looks like this arrow on the left side of the slide. But the reality is that engaging people in improvement is quite messy. It's not straightforward. There's many ups and downs, twists and turns, hurt feelings. That's how the reality is. But when we present diagrams, just like when you look on a map, and an intersection on the map, it looks clean and neat. But if you're in the middle of that intersection, then it's life all around you. So we have to express our models in simpler ways so we can work with them. But the question is, how do you navigate a complex reality like that? We've learned in our experience that we need to build trust in each person, in the team, and in the vision. This applies to everyone who engages in improvement. Amy Edmondson from Harvard demonstrated this in many of her books and articles focused on psychological safety and teaming. Okay, so how do we build that trust, you may ask me? Trust happens when everyone listens deeply and openly to everybody else's perspectives. Daniel Coyle, in his book, The Culture Code, speaks about the need for a culture where people feel safe with each other because they share a future and have a voice in shaping that future. That means that nobody is afraid to speak up. Nobody is afraid to ask for and to get honest feedback because they do want to be the best they can be in shaping that future. In our journey, we learned that trust and safe culture is key when engaging in healthcare improvement because it does make that journey smoother, that's for sure. Another thing that we have learned in our journey is that we need to find our place and our purpose. For us in Canada and in patient safety, it meant that our place is one of the three primary stakeholders in healthcare. Those are patients, providers, and leaders. We need to stay connected with our focus and our purpose, which is both to prevent harm as well as preventing second harm. And that is the harm expected by patients and families from how we respond to a patient safety incident. That applies to both at the point of care as well as the system levels. Our priority with Patients for Patient Safety Canada is the system level. And our goal is to influence those policies, practices, standards, education, accreditation, and so on. Those things then in return influence what's happening at the point of care. So any action that we take impacts in one way or another multiple people and multiple systems. So we always have to keep an eye on the context and the dynamics, like when a pandemic happens. Always consider when and where to push for change. And maybe sometimes it's better to just pause and wait until the time is right. Keep an eye out for the energy level of the patient partners, of your volunteers, because they can be burned out. So it's always a dance and a balance that we need to keep an eye on. Now, to maintain that balance, but still make an impact, we need to pick the right engagement method at the right time for the right people and for the project. My colleague Anne expressed this well when she said that the safety happens when we match the wisdom of patients and families with the willingness of the providers and leaders. So the engagement strategy should be more than just a fit for purpose, but a match of the passion and the purpose, using whatever method is appropriate. This image on the slide is one of the many frameworks for engagement that you may be familiar with. We adapted it because it's simpler, but it still illustrates the different system levels and options for engagement. But we added a new feature, and that is the lead. We would like to, based on our experience, we would like to encourage everyone to encourage the patient partners to take a leadership role, tell us which direction to go, and help them lead. This is what we do at the Canadian Patient Safety Institute. When we encourage Patients for Patient Safety Canada to identify the strategies, priorities, and actions they want to take. And then we support them in actually implementing those strategies. And they included the government engagement program that Robin has just talked about. But I'll give you a few more examples and a few tools. So when we think about patient safety at the point of care, first we need to recognize that engagement is involved because we recognize the power patients bring through their lived experiences with illness. They are the experts in their health, in the healthcare journey, and the issues they have. So our duty is to make it safe for everyone to participate and to engage. On the screen, I have two projects that were co-developed with patients. One comes from the Manitoba Institute for Patient Safety, who launched their It's Safe to Ask program many, many years ago. It was directed to the patients and the public, and it's very, very successful. And now they created a twin, the other side of the coin, and it's called Make It Safe to Ask. And this one is directed to healthcare workers and leaders. And it's focused on how to create that environment to ask questions. And the other example that I have on the screen is the 5 questions to ask about your medication. Patients helped create this tool in a very simple and practical way, so they can use it when they have questions about their medication. This tool has been so successful, it's translated in probably 40, 50 languages, and it's used around the world. Moving on at organizational levels, this is where we have patient partners. Those are people that experienced unsafe care, and they are now part of a patient group. In North America, they're called PFACs, Patient and Family Advisory Councils. And here, those patient partners engage with managers and leaders to understand the safety in that unique organization, create or revise policies, and create tools and resources. I have 2 examples for you. One is the measurement and monitoring of safety, or the way I like to call that project is, are we safe or just lucky? This project is focused on understanding in a more holistic way what safety means. And that has 5 elements. The past harm, so has patient care been safe in the past? Reliability, in other words, are our systems and processes reliable? Sensitivity to operations, is care safe today? Anticipation and preparedness, will care be safe in the future? And integration and learning, are we responding and improving? So this project called Measurement and Monitoring of Safety is actually catching fire across Canada, and many organizations are implementing it because it really opens up their eyes into what safety means. And we have a research project co-led the co-chairs are a patient and a researcher focused on understanding safety from the lens of patients and family caregivers. The second example at organizational level I would like to include here is from our colleagues at the Canadian Foundation for Healthcare Improvement, who just recently launched their Better Together program focused on the reintegration of family caregivers as essential partners in care at a time of COVID. What happened, the Better Together campaign in Canada and probably other countries was going very well until COVID hit, and then nobody was allowed in any healthcare organizations. But there's still safety concerns. So our colleagues created this framework with 7 steps for reintegration of family caregivers as essential partners, not as visitors, but partners in care and safety. So I have references to this in one of my last slides, and I'll just let you know that all of the slides are for you. I created them for you. So at system levels, I think Robin already talked about this. Patients are willing to engage with citizens, with communities, with ministers of health, and any others who are willing to listen or not to talk about patient safety. And I will just highlight here the strategy initiated by Patients for Patient Safety Canada to create alliances with other patient groups. We called it the Patient Alliance for Patient Safety, in an attempt to unite the voices of patients from across the country in improving safety. We also continue to write letters, to ask questions, to be involved, even if others are setting the tables. This is where we think we can truly add value in Canada. And in my presentation, I hope to share with you some of our key lessons from our journey, some examples and resources to help you. I will conclude with a few key principles because, like anything that grows, patient engagement in improving healthcare needs to be nurtured every single day. So 3 principles. 1, be outcome oriented. What is your why, your imperative for engagement? For us is patient safety. Respect. How we treat each other, how we respect all of the voices, all the stories, and create safe spaces for everyone to be comfortable to speak up is key. And thirdly, inclusion. Remove the barriers for participation because we need all voices to be at the table. We need every patient to be safe, no matter what their postal code is, no matter the color of their skin or anything. Everyone should be safe. I chose this acronym because it also links to return on investment, those of you who have business inclinations. If we engage with those 3 principles in mind, there is indeed a return on investment of a financial nature. And it's not just me who says that, even the World Health Organization said that in one of their calls to actions in 2019. Where they estimated that engaging patients can reduce the burden of harm by 15% and saving a lot of money. But I told you about our special power, which is that we can see behind the numbers. So one of our Patients for Patient Safety Canada members, Phil, compared the power of patient engagement with Niagara Falls. He said that the knowledge and energy within those who experienced harm is like the Niagara River, before it was harnessed to produce the greatest social benefit that it has for so many years. So it is our imperative and our duty to do the same in healthcare. Let's continue to learn from each other because we are stronger together. Here are the resources that I mentioned that I think would be helpful to you. And in closing, you still have my contact information, so feel free to reach out if I can help in other way, or if you think you can help us achieve safer care together.
Thank you very much, Iona. The leadership that Canadian Patient Safety has demonstrated on improving the journey for patient empowerment engagement has been tremendous. The tools and the strategies that you've shared are great. I'm sure people will want more information on those, and we will have further discussion. And now I'll move on to Dr. Hassawi. Welcome, Dr. Hassawi. How are you tonight? So Dr. Hassawi is the former Director General of the Saudi Patient Safety Center and MOH, and he's also the advisor to Saudi Central Board for Accreditation on Health Institutions. And he's led the efforts to establish a Saudi Patient Safety Center as a WHO Collaborating Center for Patient Safety Policies and Strategies. It's one of only 5 WHO collaborating centers worldwide in this field. He holds a dual certified boards, American and Canadian, of general surgery with subspecialty in transplant and hepatobiliary surgery. I know I never say that right. He's a consultant to several national and international quality and safety organizations, and recently became an executive committee member of the Global Sepsis Alliance. He was part of the expert panel on the 3rd Global Patient Safety Challenge of WHO. He chaired the organizing committee for the 4th Global Ministerial Summit on Patient Safety in Jeddah, Saudi Arabia, where we declared the Jeddah Declaration. And Dr. Hassawi has helped introduce patient safety as a G20 priority in the 2020 G20 of Saudi Arabia. And I need to say it was more than helped introduce. Dr. Hassawi showed tremendous leadership and passion in moving that patient safety priority forward. Currently, Dr. Asai is part of the WHO's Global Patient Safety Action Plan Task Force. Welcome, Dr. Asai. He's our leader here in Saudi Arabia for patient safety, and he's going to give us a little talk on patient empowerment, Saudi Arabia Kingdom experience.
Thank you very much, Anita. And I want to say that Anita is a close colleague that we've worked together over the past 3 years at the Saudi Patient Safety Center. And even though I left a couple of days ago, my post in the Saudi Patient Safety Center, but the passion and commitment to patient safety is still there. It is international, webinar, even though, regardless of the numbers, sometimes smaller numbers could actually move mountains. As far as international goes, I've always viewed myself as a global citizen. And we've got a Nova Scotian here on the webinar. I was really moved by all the previous three speakers. My training in Canada was in Halifax, Nova Scotia. My 16-year-old was born in Halifax, so he's half Haligonian, half Saudi, and my 10-year-old daughter was born in New York City. So even my family is also embodies the whole kind of global citizenship. And if you go to the human genome, once it was discovered, we realized that all the 7 billion plus of us on planet Earth share more than 99.5% of our genetic makeup. So think about this. People on this webinar and people throughout the globe share 99.5% of our genetic makeup. So what makes us different is only less than 0.5%. So we're almost identical twins, but somehow we focus on that less than 5% that basically the differences, rather than embracing the similarities. I want to start with the definition of the WHO's the WHO's definition of health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. And I used to teach at King Abdulaziz University here in Jeddah in Saudi Arabia, and that's what I taught my students, my residents, and I continue to be engaged with clinical practice, and that's what I discuss with residents and team members, that you will always have the chance to move any individual that you come across towards health. Whether, whatever stage of illness that they're in, you can always move them more positively, either physically or mentally or socially. Just having the patient leaves your encounter with a smile is actually something positive. And if you read up more about genetics and epigenetics, there's actually way more tools to treat disease rather than just the conventional ones. And the epigenetics is about promoting the psychosocial and mental aspects of patients, which could actually be very helpful to boosting the immune system, and a strong immune system could actually fight off any disease, cancers and others. Now, just to give you an idea, I was asked to talk about patient empowerment in Saudi Arabia, and Saudi Arabia has more than 32 million people. 20 million are citizens, and 12 million plus are expats. Unlike some other countries throughout the globe, healthcare in Saudi Arabia is a right. So all citizens are covered by the government. Now there are around 3-4 million people that work in the private sector, together with the expats that work in the private sector, are covered by employer-based insurance. Now, throughout the COVID pandemic, the King also basically asked the government to cover every single individual, even people that are present in the kingdom illegally, to be treated by the government for free. So the government of Saudi Arabia takes healthcare very seriously, and that would kind of help us with how we kind of push the patient safety agenda forward. Now, it is helpful to kind of just think about patient empowerment in Saudi at 3 different levels. So the regulator level, the provider level, and the community level. So at the level of the regulators, the Ministry of Health has been very active to push for patients and families' rights. There's a hotline that everyone here in Saudi knows about, which is 937. So if you have any complaints, if you have any consultations, etc. So 937 is a number that you can call up and you can get help and support. Sibahi, which is our national accreditation organization, also has specific chapters in their standards about patient and family empowerments, and it's about patient and families also education. I just became, I worked for Sibahi before I joined the Ministry of Health just to kind of help establish the Saudi Patient Safety Center, and I was just asked by Sibahi to come back as an advisor to work on the standard development and hospital accreditation moving forward. So you will rest assured that patients and families' empowerments and engagement will be very present and will be felt in the standards. Not only that, we're also thinking about putting patient surveyors as moving forward. So that's kind of what is in the pipeline. SPSC is my home, my heart, my colleagues that helped in the Saudi Patient Safety Center, and Anita is one of the great people that still continues to work there, has done a lot of work and to promote patient empowerment. There's lately, we've got a department that has a main focus on patient empowerment. Anita also is an advisor with a main focus on patient empowerment and on public health. But lately we've also engaged with the OECD, where they are piloting a survey about patient reported indicators. So that's another kind of one of the things that we're working on to promote patient empowerment. There's an organization called the CCHI, which is the Council on Cooperative Health Insurance. It regulates private insurance in Saudi. So the private insurance market has around 11 million people. And they have a hotline for empowering their customers who are the policy holders. Now, so that's all. These are different pieces of the regulator. So that's one aspect of promoting patient empowerment at the level of the regulators. The other is the providers, and the providers also have seen some progress in promoting patient empowerment and engagement. Patient experience is getting traction in Saudi as we're moving forward. Press Ganey, surveys is picking up steam, and many of the Ministry of Health hospitals are using that in addition to other hospitals. Also, the Planetary accreditation is also present in Saudi, and there are a number of organizations that have gone through the accreditation. The concept of patient and family advisory councils is also strong, but you can never say that we've done enough. I truly believe that to reach full co-production where patients and families from one end and healthcare providers from the other end are co-producing high quality and patient safety and safe care. If that full implementation takes place, I will have to disagree with the WHO that the ROI will be way more than 15%. So I think we've got some a big room for improvement, but I think just the work that we see throughout the globe in this area is a reason for optimism. So that's the level of the providers. Now, at the level of the community, the Saudi Patient Safety Center has patient and family advisory councils that are kind of linked to different regions in Saudi, and that's helpful. But also there are a number of NGOs. This webinar could not have happened if it wasn't for one of them, which is Motaafi, that kind of promotes cancer survivors. But also, there are other organizations that we have dealt with as the Saudi Patient Safety Center, and there are others that we haven't. As patient groups that are also very active. With the G20 that is just kind of taking place through this year, the C20, which is the Civil Society 20, is also very active, and the NGOs within Saudi are leading. As the Saudi presidency is responsible for that, they're leading a number of different initiatives under the umbrella of healthcare. Now, have we done enough globally? This movement of patient safety, the global movement, is more than 20-year-old. After the famous report to Err is Human back in 1999. But one of the reasons that we pushed to put patient safety on the G20 agenda was that there's still millions of people that lose their lives globally due to unsafe care and preventable harm. There are, as I said, on the executive board of the Global Sepsis Alliance, and every year there are 11 million people that die from antimicrobial resistance. That die from sepsis. Antimicrobial resistance, on the other end, there currently kills around 700,000 people annually, and by the year, basically by the year 2050, if the trajectory continues as is, it is estimated that AMR will kill around 10 million people annually. So these are, horrendous numbers that, even though that this huge industry that was built to kind of provide care and look after people, end up, unfortunately, with the number of stories that we have heard here, and we've the number of stories we've heard here, and the other stories throughout the globe are ending up, being harmed, unfortunately, by the same system that is supposed to help them. So I would say that I think such a webinar is a reason for optimism. I think the more that we listen to these stories and the more strategic interventions that we have moving forward is going to be helpful. I would say that we also need to kind of rethink the definition of patient safety, moving from one size fits all into more personalized and proactive definition. And I like the slogan that every patient, what I heard about safe, every patient safe, but I would say every patient safe every time, all the times. And again, with that, I'm thankful for the opportunity to talk to you. This is a marathon. It's a long journey, but I think with the passion and the commitment, I believe we'll be able to get there. So thank you, and I look forward to any questions.
Thank you, Dr. Sawi. The journey in Saudi Arabia has been an interesting one, and there's lots more to go, and we look forward to having you continue as a patient safety advocate, that's for sure. So I'd like to now move on, just respecting time. We're getting a little bit behind here. Dr. Abdullah Al-Khattam, he's a member of the board of directors of the Association of Social Workers and a member of the faculty. And he will speak a little bit about the social work and advocacy during COVID-19. Welcome.
Thank you, Nadia, and thank you for all the presenters, and thank you for Motaafi for this webinar. And Robin, I could say actually, you are a beating heart of this world. You moved me with your story. Actually, I would like to talk about the social work advocate during COVID-19, and allow me please to share the screen with you, this presentation. Through COVID-19, the Association of Social Work devoted a great deal of time and resources through many venues, online and offline, to work with social workers, advocates for patients and the general public. We contributed to the awareness of the risk factors that may cause the spread of COVID, and emphasized the importance of social physical distance to maintain public health and avoid infection. And as you all know, we are as a human social species. And one of the challenges actually we faced during this pandemic, the keeping social and physical distance. And we worked hard through our actually social programming to help people to keep social distancing. In Saudi Arabia, as you know, one of the greatest country in the world, people are still actually social cohesive. And the cohesive, you can see in Saudi Arabia, many actually families that extended families. So keeping social distance was a challenge to maintain public health. While we worked with the public health administrators through the association and other organizations to make the social distance easier for the people. As well, we focused on connecting patients and clients to social resources that in need. People actually lost their jobs during this pandemic, and we helped them to cope with that. As well, we support and communication management to patients and clients through our e-channels. So we did actually ease the social distancing impact on patients and clients and the general public. As well, we help to stress relief and management by helping patients and clients to understand several coping strategies, comforting patients and clients through physical aids, engagement and optimistic view of the future, and constant communication with patients and clients to ensure they have access to all resources and the assistance needed. They also educate, clarify, and provide trusted sources of information about COVID to the people and patients and clients as well. We encourage COVID patients to follow the medical advices and procedures for fast and complete recovery. We offered them several theoretical methods and implementing plans for the near future in form of social and psychological and economical interventions. As well, I would like to talk about a little bit about the Association of Social Works in Saudi Arabia. We have a mission and vision and value. Our mission is to commit to the development and enhancement of the profession of social work in a way that meets professional need and enhance services to clients. Our vision is to achieve quality, uniqueness, advancement, and empowering the profession of social work at the local, regional, and international levels. Our values are integrity, competence, collaboration, and initiative. So to help actually patients and people to understand the role of the social worker, we have several strategies in the social work, in the Association of Social Workers. We focused on professional practices, achieving efficiency and effectiveness that will elevate the profession of social work in various fields, increase our efforts in cooperation and partnership with our authorities, community leaders, and organizations to employ graduates who specialize in social work, invest in our capability to support various programs to raise awareness of the role of social workers and the profession of social work. Lastly, we expand and diversify our sources of nonprofit income to achieve our goals. To help actually reach these strategies, we have several objectives as well to help train and qualify social workers, provide professional consultation. We devote a great deal of time and resources to raise awareness of the role of social workers and the importance of the profession of social work. We contributed to providing employment opportunities for social workers. And we did actually several cooperation agreements with several organizations in Saudi Arabia to help reach our objectives. We have cooperation agreements with the Saudi Society for Health Social Work, with Ummi Initiative to train and qualify social work. And Ummi is representative for, it's the Arabic word of mother. And with Saudi Khairi Initiative, with Saudi Social Work at King Fahd University Hospital and Al-Khabar City. As well, we signed a cooperation agreement with the Ministry of Human Resources and Social Development, with King Salman Charitable Society for Housing, Population Management, and lastly, with Motaafi Foundation. We have in this association a lot of programs, the academic and professional program, and aiming to improve social worker, graduates, and practitioners in multiple paths to be up to date with the new advances in social work. We have the empowering program that targets to qualify social work graduates for professional work with the participation of various organizations. As well, we have the expert program with targets to the leaders working in the field of social work to enhance their administrative and professional skills. Lastly, the social research program, which aims to improve the skills of researchers in social work. So the Association of Social Workers in Saudi Arabia, it's a newly association, and it's planning actually to expand nearly in the future, in the soon future, and it's helped during the pandemic, COVID-19, help the community and social workers and the general public to avoid the problems from the COVID-19. We have actually we reached right now 675 members. We trained 9,600 trainees in several fields of social work, and we hope actually to reach more members and train a lot of social workers. Thank you for listening, and this is just overview of the Association of Social Work. Thank you.
Thank you very much. Your work during COVID, I heard lots from Makia, was tremendous. I think the connections that people need, especially during social isolation and being with their loved ones in hospitals, was very important. Thank you very much for that. Now we're opening up for questions and discussion. And we have Makia and some other people that will help us with any interpretation. So we will open it up for questions. So if people could either direct the question to the person or just say it's open to anybody, that would be really helpful. So let's, is there any questions, Makia, that we have?
Excuse me, on behalf of you, Ms. Anita, I would like to speak in Arabic, so other attendees, if they have any other question in Arabic, so we can translate it to them. بخصوص الجلسة اليوم، إذا كانت عندكم استفسارات أي أسئلة ممكن نطرحها على ضيوفنا، فريق الترجمة جاهز وباستعداد تام لاستقبالها. حياكم.
Is that question being interpreted?
For the meanwhile that we are waiting for questions, I would like to thank Ms. Natalie and Ms. Robin Iwana from the Canadian Patient Safety Institution. Also, Dr. Abdulilal Housawi, he is the one from Saudi Arabia that we are proud of him, and also Dr. Abdulaziz from the social workers. We are all together, so we live at a great planet. We're trying to improve quality of services, quality of life around countries. Here, Motaafi is trying to do some effort for the SDGs, also for the other communities. This is the first international webinar. It's not going to be the last, for sure. Taking other experiences outside of Saudi Arabia, making us thinking ahead more professional way, so we can make life easy for the human being in this planet. Iwana has just created a methodology that we can use through Motaafi, inshallah, and we can improve the healthcare system and quality of services. Natalie has bring the experience, about 25 years old, that it based on a personal experience for that block. It's a remarkable. I know, and I heard that story from the last conference at 2019 here in Saudi Arabia. And I'm proud that I know Ms. Natalie closely also. Ms. Anita is a professional monitor. Dr. Abdulillah Al-Housawi, he's a remarkable guy. He's the one for the advocacy, also for the healthcare system. We are all here, also with Dr. Abdulaziz as a social workers. He is a member of faculty in Imam University. He graduated many university students to help and support the system and also the social impact. We are not saying that effort it's only for Saudi Arabia. It's between country, across the borders, for all SDGs agenda. So we can live in a good planet and also to improve the quality of services around the world. Social workers are the most and important one indicator of the healthcare system. We can monitor this thing with collaborating between other subjects and other specialties.
Can I you know, as we're waiting for questions, and because I also have another meeting to go to, I want to take the opportunity to make you know, a proposal. And you know, the common theme in many of the stories of harm that we hear, you know, the ones that we've heard tonight and throughout, you know, the past you know, decades, the common theme is that while in healthcare, that we're catching those stories very late. We're actually catching those stories after the fact. You know, when we compare healthcare to other HRO organizations, the high reliability organizations, I just came from Riyadh to Jeddah today. You know, my brother is a pilot in Saudi Airlines, and you know, the oil and gas industry, the nuclear industry, all these industries became high reliability because they're more proactive, and safety literally in those industries is like religion. And so one of the proposals that I've been pushing even in our meetings with the WHO is, why don't we have a patient safety consent? So rather than having an informed consent for interventions, what if we, at the time of the engagement with the healthcare system, so either for someone coming in through admission or someone coming in for an outpatient setting, the patient fills out something called the patient safety consent. And that patient safety consent is personalized around what the patient you know, diagnosis and plan of treatment is. So if I'm being admitted for a hip replacement, historically we know what the top 5-10 potential harms that could happen to patients from a hip replacement. If you could also add to it whatever, you know, medical condition the patient is in, we can tell the patient in a co-production framework that, you know, these are the top 10 things that could happen to you. These are the top safety concerns that could happen to you through the admission. And this is how we can jointly work together to prevent it. So you and your family, these are the things you could do, and these are the things that we could do as providers. You know, the same that could apply to any types of cancer, since we're discussing here around you know, cancer survivors. You know, going through from the time of, imagine, and this is something that Motaafi could push forward. Imagine at the time of the diagnosis that you have a patient safety consent, and that's different from the intervention. So patient safety consent that is personalized, start to end, about the patient journey. So you've got a diagnosis, and then you've got a treatment plan, and then the treatment plan have either 2 or 3 components: surgical intervention, chemotherapy, plus minus radiation, or any varieties of those. And then the patient, through the help of social workers, you know, coordinators, case managers, could actually have clarity on the safety areas throughout the journey. So if the treatment is 3 months or 6 months, then throughout the journey, you have these different points. And even we could leverage technology to kind of just remind us that, oh, this is the point that we need to worry about this. And then we do it in a collaborative way. So it's a very kind of long discussion and that I'm trying to push forward, which is moving from reactive, waiting until harm happens, into more proactive, moving into, you know, generic one size fits all into personalized, because the definition of safety should be, you know, the absence of harm for every patient in 24 hours, you know, 24/7, basically, as they're being dealt with through the healthcare system. So again, that's just one of the you know, proposals that I've been pushing forward. I think that can help us, and this could apply either in a high income setting or even low middle income country settings, because it's basically just the concept of highlighting the safety concerns for every case by case. So rather than waiting until harm happens and then we intervene, let's put this at the beginning, you know, as a checkpoint, and let's empower patients at the basically upstream level rather than intervening, because again, HR organizations, the difference between them and us in healthcare, if harm happens at step 10, they intervene at step 2 and 1. We intervene at step 9, sometimes we intervene at step 12 after the harm. So think, how can we move it more towards proactive? So again, that's a proposal just for everyone, since we're having these discussions and we're trying to come up with something practical as we move forward. I think proactivity and personalization is going to help with empowerment and with meaningful co-production.
Thank you, Dr. Sawi. I would have been disappointed if you hadn't given us a challenge at the end. I think it's an idea that I know we've discussed, and I don't know if others have any thoughts about it or would like to share any thoughts on that. But I think it's, again, you know, that proactiveness that you're saying, engaging and working collaboratively with our healthcare workers to prevent harm. So I think it's an idea to explore. Anybody else? I think if you can get WHO to start moving on it, we'll take it back to patients, Saudi Patient Safety Center to push forward as well. And Motaafi, I think if we could work together on it, I think that would be fabulous. And pilot something like that would be excellent. We don't have any questions. We just have one about someone wanting to know if
I have a
how
final
they can
comment.
take a patient engagement course, and they can come volunteer with us at Saudi Patient Safety Center, and we'll start training them. Fahd, did you have something more to add? And then we should be wrapping up.
Yeah, I have a final comment only for this session, for this international webinar.
Sure.
That through all challenges that has been between countries, and also the time, the crisis, the pandemic that happened, patient engagement and patient empowerment is still remain the priority of the leaders and communities to develop more the healthcare system and healthcare quality of services. We here at Motaafi are proud of our team, especially also Makia and Bandari, the IT infrastructure, and Makia is the soldier that has been making all that success to the surf. All thanks to everyone who participated today. All thanks to Makia and achieving the goal that we have been talking about as an ambition. Today we made it, and we can do more than that. We are empowering ourselves. We are challenging to improve a healthy human being planet. Thank you, Anita.
Thank you very much. And I think if there's no further questions, it was a very insightful, and I know I learned so much tonight as well. And I think we need to take some of this back, and Makia, we'll be talking tomorrow. So thank you very much, everyone, and good night.